Hello, friends. I'm Dr. Iris Amelia. Today, we're going to talk about a topic that many people still feel scared or hesitant to discuss openly: HIV and AIDS. And it's important we talk about it because every year on December 1st, the world comes together on World AIDS Day for one purpose: awareness, prevention, and support. So today, I want to help you clear away myths, understand the real science, and see how far modern medicine has come in controlling this condition. When we replace fear with facts, we become stronger, healthier, and more compassionate as a society. Let's begin with how it all started. The first recognized cases of AIDS were reported in the early 1980s. Doctors suddenly began seeing young, previously healthy people developing infections and cancers that usually only occur in people with severely weakened immune systems. After intense research, scientists discovered the cause: a new virus, HIV, or human immunodeficiency virus. Most research points to Central Africa as the origin, where the virus crossed from monkeys to humans many decades earlier. By 1981, the US CDC documented the first official cases. But because people didn't understand how HIV spreads, fear and misunderstanding spread faster than the virus itself. Now let's clear up a basic confusion. HIV and AIDS are not the same thing. HIV is the virus. AIDS is the advanced stage that happens only after years of untreated HIV, when the immune system becomes extremely weak. A person with HIV does not automatically have AIDS. In fact, with early diagnosis and proper medication, an HIV-positive person can live a long, healthy, completely normal life without ever progressing to AIDS. So, how does HIV actually spread? Let's make this crystal clear. HIV does not spread through air. It does not spread through hugging, shaking hands, sharing food, or using the same toilet. It does not spread through mosquito bites or casual contact. HIV spreads only through specific situations: unprotected sexual contact with someone who has HIV, sharing needles, receiving infected blood, and from mother to baby during pregnancy, childbirth, or breastfeeding. Multiple unprotected partners also increase risk. Outside these situations, HIV cannot spread. Because of stigma, many myths continue to circulate. One popular myth is that mosquitoes spread HIV. This is completely false. Another myth is that people with HIV should be avoided. Not only is this wrong, it's deeply hurtful. People living with HIV need respect, support, and accurate medical care. And then there's the myth that there's no point in testing because HIV has no cure. Yes, HIV has no permanent cure yet, but it absolutely has effective treatment. And that treatment can suppress the virus to levels so low it becomes undetectable. And here's one of the biggest breakthroughs in HIV science. When HIV becomes undetectable, it becomes untransmittable. This means a person with an undetectable viral load cannot transmit the virus sexually. This single discovery has changed millions of lives. Today, HIV management is more advanced than ever. Daily ART medications allow people to live long, healthy lifespans. We also have PrEP, a daily pill that prevents HIV infection with extremely high effectiveness. Rapid self-testing kits are widely available. Long-acting injection treatments and vaccine research are underway. HIV has become a manageable chronic condition, similar to diabetes or high blood pressure. But even with all this progress, prevention remains incredibly important. And the simplest, most effective tool we have is the condom. Condoms protect against HIV, other STDs, and unwanted pregnancy. They're safe, affordable, and easy to use. Yet many people still hesitate or believe myths about them. Let's address a few common misconceptions. Many people think their penis is too big for condoms. In reality, condoms are extremely stretchable. Models have demonstrated that they can stretch over an entire forearm or even a leg. If you need a larger size, choose one, but never wear a loose condom, as it can slip off. Another misconception is about flavored condoms. These are designed for oral sex. They should not be used for vaginal intercourse because the sugar and flavoring agents can irritate vaginal tissue and increase infection risk. The lubrication and flavors are safe for oral use, but not ideal for penetration. Storage also matters. Keeping condoms in a wallet or hot car can weaken the material. Friction creates tiny tears. They should be kept in a cool, dry place, and you should always check the expiration date. And remember, the condom should go on before any genital contact, not after things already start heating up. Think of it as part of foreplay, not a last-second interruption. Another important question people ask is, who should carry condoms, men or women? The answer is simple. Anyone who wants to stay protected. Sexual health is a shared responsibility, not a gender-specific duty. Now, let's talk about testing. Early testing saves lives. The sooner HIV is detected, the sooner treatment can begin, and the better the long-term outcome. Free HIV testing is available in government hospitals, and confidential testing is offered by NGOs and private clinics. There is no shame in getting tested. It is a sign of maturity and responsibility. This World AIDS Day, let's make a commitment to spread awareness, to stand up against myths, to support people living with HIV, and to take sexual health seriously. The virus is not the biggest enemy. Stigma is. But if we stand together, both can be overcome. Knowledge is power, and the more accurate information we share, the healthier our communities become. Thank you for joining me today. Take care of yourselves and stay informed, because your health, your safety, and your dignity are worth it.